production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Thank you for joining us for this edition of Being Well. My name is Lori Casey, and I'm so happy that Lisa Cornwall and Debbie Griffin from Paris Community Hospital Family Medical Center are here today to talk to us about type 1 diabetes. It's a big topic, and we've got a lot to get through, so let's get started. Why don't you first explain, either one of you, the difference between type 1 and type 2 diabetes?
Okay, I'll be glad to do that, Lori. Thank you for having us. Type 1 diabetes is where the pancreas stops producing insulin production. There are beta cells that are produced by the pancreas that normally produce insulin, and in type 1 diabetes that process is totally deficient. So the beta cells stop producing insulin, and therefore a type 1 diabetic needs to be supplemented with insulin injections to live. Type 1 occurs in 5% of the population. The other 95% of population of diabetics are type 2. Type 2 is a different process. It's generally speaking, the pancreas is producing insulin in the beginning of the disease process. In fact, too much insulin production occurs, and the liver is dumping glucose at night when we sleep, and our tissues and cells are not accepting what insulin is being produced. So the difference is with type 1, you automatically go on insulin therapy as soon as you're diagnosed. Type 2, insulin therapy can be implemented later in the disease process, but in the beginning, not so.
Because they'll put them on a diet or change their, and sometimes that can reduce or get rid of the diabetes.
That's right.
So you had a son diagnosed with diabetes at a very young age. Can you tell us what that was like, raising a son? Because how young was he when he was diagnosed?
He was 16 months when he was diagnosed a type 1 diabetic. His father, my husband, is a diabetic. He is type 1, and he was diagnosed at age 14. And when we went through getting married, we went through genetic counseling, and the risk of type 1 diabetic being born to a parent of diabetes type 1 was only 3 to 5% chance, so very small percentage, and he developed it, our son, who was 16 months old at the time. The symptoms at that point were very acute. He was sick to his stomach, urinating quite frequently, and drinking a large amount. So being in the healthcare field, I felt that it might be his sugar, and we checked it, and it was 700 plus at the time. So we were admitted at Carle Hospital in Champaign-Urbana and stayed there for a week at the time, and it was very frightening for him and us. He was on insulin injections starting at nighttime and testing his sugar 4 to 6 times a day, and for a 16-month-old, that's very difficult.
Oh, I bet.
So the treatment has come a long way, and we're very fortunate to have new analogs with insulins. Back then, the insulin that was used for him, when you gave him the injection, he had to eat, and it was longer acting insulin, which combined with other insulins he was on made him more prone to low blood sugar. You gave the insulin, had to wait 20 minutes, make him eat food, and hope he did. But now we have insulins that you can actually dose after a meal, so it's much more conducive to toddlers.
So is having type 1 more dangerous than type 2, or can they both have the same long-term health effects?
They both have the same long-term health effects if their sugars are not controlled. There are some differences, different complications with type 1 as opposed to type 2. Type 1, like Debbie said, you have to be on the insulin. You have low blood sugars, which type 2 diabetics can have as well. They have they can go into a condition called DKA, which is where the body is breaking down and using fats as energy as opposed to the sugar. That ketones in your blood are very dangerous. They can be poisonous, so you end up in the emergency room, very serious condition. That happens more with type 1 when your blood sugars get too high and there's not enough insulin present, as opposed to type 2. Long-term complications, retinopathy that causes blindness, kidney damage, can lead to dialysis, neuropathy, numbness, tingling, loss in sensation in your feet and legs, increase for heart attacks, strokes. Those are all long-term complications of both type 1 and type 2.
So what is it about diabetes that can create those long-term health effects? What is the diabetes doing to their body that can create heart disease later on in life?
High blood sugars, the high amount of glucose in the bloodstream damages the small vessels, and that's why the kidneys, the eyes, the nerve endings are the ones that are affected, because they're the small endings.
So your son was diagnosed at a very early age. At what age range can people be diagnosed with type 1? Can you get it in your 20s, or if you're going to get it, if you're going to have it, will it be much younger?
Sure. You can still get it in your 20s. Even I've seen people in their 30s, develop type 1. Generally speaking, it used to be called juvenile diabetes. And it was mainly, under the age of 20. But there are patients that are very thin in stature that do develop type 1 diabetes at a later age.
Okay. So is the diagnosis for type 1 different than for type 2? Or are the testing methods the same?
The testing methods are the same.
Okay.
They do lab work, check your blood sugar, check a fasting blood sugar. Obviously, if you come sick into the hospital, they're going to do blood work. If your sugar is above a certain range, they know that you're a diabetic. Then from there, it's just differentiating between type 1 and type 2, and it all depends on the symptoms you present with, and how critical you are at that point.
Okay. Now, just to review, what would be a normal blood sugar level?
Fasting blood sugar, which means first thing in the morning before you have anything to eat or drink, in a non-diabetic should between 70 and 100 is normal. 101 to 125 is pre-diabetic. Okay. And then anything greater than 126 is diabetic.
Okay. So if you have, with type 2, you can be pre-diabetic. You really can't, is it true that you can't really be pre-diabetic with type 1?
That's correct.
Okay. So does a type 1 diabetic manage their diabetes the same way a type 2 does, or is it a little bit different process?
Essentially, it's the same as far as testing one's blood sugar. However, with type 1, they go directly on insulin.
Okay.
Upon the diagnosis.
Right.
But often with type 1s, there are multiple daily injections, or even go so far as an insulin pump therapy, which doesn't mean that their diabetes is any more severe or non-controlled. It actually gives more flexibility to the diabetic, to the type 1 diabetic. But they still should, type 1 or type 2 should still be testing their sugar daily, depending on what medication they're on as to how frequently they test, as well as annual labs such as a lipid panel, cholesterol, checking their glycohemoglobin, which is a blood test that determines how well the blood sugar is controlled over the past 3 months, getting their eyes examined, dilated on an annual basis, an annual foot exam. So essentially, the care is the same. It's just what medication and diet and exercise program they're on.
Well, let's talk about, say there's parents out there watching and they have a child with diabetes. What advice can you give to them? You've been through it. What advice can you give to parents on how to, help their child manage diabetes?
Well, I had a very good educator that helped us get through the initial diagnosis. And she gave me some very good advice as a parent to control the diabetes. Don't let it control you or your child's illness. So I tried to make it as normal as possible for my son. I educated his teachers, everyone that he was around. I let them know about the disease, the process, the treatment, and tried to make him as normal as possible. If he wanted snacks at a birthday party, he had those snacks, but we adjusted then his medication accordingly. And to be in close contact with your healthcare provider. That's very important. Get a provider that you're comfortable with, that you can, call freely and ask questions. Have a nurse educator like Lisa. It's very important that you can be in constant communication with them, and the registered dietitian, the whole healthcare team. And if you see signs of psychosocial problems, anxiety, or depression, bring that up to the healthcare provider so they can get your child and your family help, because it's a chronic disease, and there is a lot of depression that can go along with that. So being open communication with your child and with your healthcare team is very important.
Lisa, go ahead, Lisa.
I would just let them know that they're not alone. If they have questions, reach out, to your healthcare team. There's other parents out there, support groups that can help them cope, because it is a lifestyle change when you're diagnosed, especially when it's your child.
Yes.
So reach out to your healthcare team, your educator, other parents who may be experiencing the same thing, and just let them know that they're not alone.
Does it get more challenging as your child turns into a teenager and they want to strike out and be more independent? Do you see more non-compliance in teenage diabetics, or at that time are they used to it?
Generally speaking, yes. We were very fortunate. Our son has done quite well, and has had good glycohemoglobins and good health. He thus far has no complications, so we're very blessed because he's had it for 25 years. But generally speaking, the teenage years can be difficult because of the growth hormones in their body, and the different hormones that can regulate the sugar. It makes it a little more difficult. Physiologically speaking, not only emotionally speaking, wanting to be independent and do as they wish. But that's where the new forms of therapy, and including the insulin pump, comes into play, because it gives them much more flexibility to do so.
What about, is there a difference in how it affects boys versus girls when they get to those teenage years, girls and hormones, boys versus and hormones? Do you notice anything different?